Ebola has been a top story for quite some time, and we've devoted several shows to the topic. With me today on Missouri Medical Focus is Dr. Stevan Whitt, Chief Medical Officer for University of Missouri Healthcare. Dr. Whitt, as I said, there has been quite a bit of coverage on this issue, most of it based on fear that a similar outbreak currently taking place in West Africa could occur here in the U.S. As deadly as it is, Ebola is actually not that easily transmitted from person to person, is it?
No, it's not nearly as easily transmitted as something like the flu or a common cold.
And why is that?
Mostly because it requires direct exposure to body substances. So somebody who is what we call viremic or has active viral replication in their body, you have to actually come into contact with their body substances such as vomit or stool or blood, heavy interaction with tears or saliva, things like that before you can really get infected.
3 states are now implementing mandatory quarantining of those returning from West Africa, regardless of exposure or symptoms. What is your take on that?
I think it's a terrible idea for several reasons. The most important reason is that you're quarantining many people who will absolutely never have the virus. That doesn't take into account things like were they exposed actually when they were in one of the West African states. It also allows an awful lot of discussion about, well, what really is West Africa? I mean, is it really the 3 countries we're talking about, or this country's really next to that country? Who's to say that they weren't exposed? And the discussion becomes nearly endless. The other is that the only way we're going to really slow Ebola down worldwide is to stop it in West Africa. If our people are not allowed to go help stop this outbreak, which they won't if they have to come back to work, or if they're not allowed to take off work for the 21 days to come back, they're not going to be allowed to go over. We really think it's going to stem the tide of healthcare workers who are going to help. I think that it's just going to allow Ebola to spread and will actually make our country at much higher risk over time.
Yeah, I would imagine it would be difficult. A lot of these people are taking the time off work from their jobs, from their personal lives, traveling there for 3 to 4 weeks at a time. To tack on almost an extra month of quarantining would really be prohibitive for them to be able to even do that.
I'm concerned that many employers would say that you just can't be off work that long, and then that would be that. So people would either have to give up their jobs for no reason, or they would have to give up the opportunity to go help stop this outbreak so that it doesn't threaten the rest of the world.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and our discussion is about Ebola. From a local standpoint, I think the concern is that someone will travel here with Ebola. If that were to happen, is MU Healthcare prepared to handle a patient with Ebola?
We are prepared. We've had in our policies for years what we call intrahemorrhagic fever standards that we've been following. But since we've had this outbreak, it's allowed us to really go through and re-emphasize our infection control procedures, and we're much more ready now than we ever were in the past.
Well, obviously, there are going to be healthcare workers involved in caring for a patient, and how are they being protected if a case of Ebola were to occur?
So there's national standards now as of last Monday that are out regarding that took into account the experience at Emory University, and
Emory's the place where the first Ebola patient was cared for that brought to the U.S. from West Africa, correct?
That's right. And where they've had no seroconversions of healthcare workers, and we've adopted those recommendations. It's a fairly extensive list of personal protective equipment, but more important than the equipment really is the technique of putting it on and taking it off and making sure that you don't contaminate yourself while you're doing that. And that's really where we've made most of the changes to our procedures, really with a kind of a buddy system to watch the next person take it on, take it off, and double-check each other. And it's such a good idea, we think, that we've actually implemented it for all of our infection control procedures, just because it's a good way to reinforce kind of 24/7, 365, even when there's not an outbreak of something, what our really good technique should be.
Why is the personal protective gear that I'm seeing on TV that is being utilized here in the United States look so different than what we're seeing that's being used in West Africa?
Well, there's a few reasons. In effect, it's the same barriers. The part of it is they have to use what's donated is part of what's going on in West Africa. The other part is that the environment is completely different. So in many cases, there's in West Africa, there's a local area, such as a tent, where they're caring for many patients with Ebola outbreaks. So the sanitary conditions there's body fluids on the ground, on the dirt, body fluids on the cots, on the blankets, on the walls, and so the chances of exposure of a healthcare worker are extraordinary. And even so, the conversions to healthcare workers has been fairly low given the risk. The second is that in the U.S., it's a totally different. It's one-on-one with a patient. We have our modern facilities where we can keep the environment clean, keep the patient clean, keep the contaminated area under much better control. The other reason is that what you see a lot on TV is what people are calling hazmat suits. These big suits. We're really, we meaning the healthcare community here in the U.S. is not really emphasizing the use of those for a few reasons. We actually think it can have lots of serious drawbacks. One is that it's so hot that you have to take care of these patients 24/7, for a week or so, a week or two, and they get so hot that people become dehydrated. You can't drink fluids with them. You can't go to the restroom with them. It's really nearly impossible to kind of stay standing wearing the suit for 8, 10, 12-hour shifts. The second is that they're very difficult to take off without contaminating yourself.
What's the most important message about Ebola that you think all of us should know?
A few things. It's important, and it should be worked on, and it should be eradicated, but it should be put into perspective. There are things that are much more threatening to us as citizens in mid-Missouri than Ebola hopefully ever will be. Simple things such as wearing your seatbelt, such as getting your flu shots, so that you can protect those vulnerable people in your community that could potentially have serious complications from the flu. It's keeping your hands washed. It's those kinds of things that really will are more likely to keep you safe and healthy than serious concerns about Ebola at the moment.
Thank you, Dr. Whitt, for being my guest for Missouri Medical Focus. I'm Jeff Helsher.